I'm Dr. Ricardo Navarro, a specialist in geriatric care, and I have something important to tell you. It's very likely that what you've been told about how to protect your brain is dangerously incomplete. You see, we all worry about diet, cholesterol, exercise. But what if I told you that the #1 cause of silent strokes might not be on your plate, but in your own bed? Every night, millions of people adopt sleeping positions that seem harmless. But according to recent studies, they can reduce the oxygen reaching their brain by up to 38%, increasing the risk by over 70%. Do you sometimes feel dizzy when you get up, a tingling in your hands, or that brain fog many mistake for fatigue or old age? These could be the first warning signs. Pay close attention, because in the next few minutes I'm going to reveal the 5 most dangerous sleeping positions, from those that seem harmless to one that Harvard scientists consider a real ticking time bomb for your brain. So I ask you, directly, what is your usual sleeping position? Have you ever woken up with a numb arm or leg without knowing why? The question isn't whether you get enough sleep, but how you sleep. Stay with me, because understanding this could literally save your life. Let's start with a position that, frankly, seems completely harmless, almost like a classic movie scene. You know that habit of sleeping on your back, but with one hand tucked under the pillow, as if you were hugging it? Well, watch out for that one. Many people do it thinking it's comfortable, a way to feel secure. But, my friend, that little habit, that simple nightly routine, hides a risk that most people are completely unaware of, and that directly affects your brain. Pay close attention to this because it's wild. When you put your hand there, your own body weight creates uneven pressure on your shoulder and neck, messing with one of the most important blood highways, the subclavian artery. The blood flow, which should be smooth as silk, becomes turbulent, like a raging river full of whirlpools. And do you know what thrives in a raging river? Exactly. The perfect scenario for small, dangerous clots to form that can travel straight to your head. Let me tell you the story of Mrs. Carmen Lopes, a vibrant 58-year-old woman. She started feeling a strange weakness in her hand and headaches that everyone blamed on just getting older. The truth is, she was suffering from microstrokes because of this very sleeping position night after night. Her case teaches us a vital lesson. The body sends us signals, but sometimes the real culprit is a silent habit we consider harmless. Crazy, right? But relax, don't panic, because the solution is simpler than it seems. Sometimes all it takes is swapping your pillow for a memory foam one that better conforms to your neck, or even using one of those wedge pillows to slightly elevate your torso and release the pressure. It's a small change for a gigantic benefit. And if you think this is surprising, just wait until I tell you about the sleeping position many people adopt that literally ages your arteries by the equivalent of 10 years. Now, let's talk about another sleeping position that looks like something out of a contortionist act, but that many people adopt. Sleeping on your stomach with your head turned completely to one side. It's almost as if you want to stare at the wall while you sleep. Sound familiar? It seems like a simple matter of comfort, a trivial thing. Well, let me tell you that this habit is a real ticking time bomb for the arteries that feed your precious brain. Look how crazy this is. By doing this, you are basically stretching the carotid artery on one side like a rubber band and crushing the one on the other side for hours on end. This not only weakens the walls of your vessels, but also creates the ideal environment for fatty plaques to form. A study from the University of Michigan revealed something that will send a chill down your spine. This sleeping position ages your blood vessels by the equivalent of 10 years. 10 years. Imagine Julio Fernandez, only 47 years old. He started seeing flashes of light, as if a camera was suddenly going off. The diagnosis was amaurosis fugax, a warning sign that blood flow to his eyes was failing intermittently. The cause? The narrowing of his left carotid artery, the very side he always turned his head toward while sleeping. His body was screaming at him to stop that habit for good. What a scare. The solution, luckily, isn't to stop sleeping, of course not. The key is to retrain your body. A fantastic solution is to use a body pillow, one of those long ones you can hug, as it forces you to stay on your side. If you add a cervical pillow, that's the icing on the cake. If these positions, which aren't even the most common, are already this dangerous, hold on tight, because the one I'm about to tell you about is what almost everyone does, and its effects are like micro blackouts in your brain. Get ready, because now we're on to one that's probably yours, the champion of all positions, sleeping on your side with your arm bent under your head as if it were your own personal pillow. A classic. Who hasn't done it? It seems like the most natural thing in the world, an almost tender gesture, right? However, behind this apparent comfort lies a silent risk that affects not only your blood flow but also a crucial bundle of nerves. The problem is that your head is heavy, very heavy. No joke. That constant pressure all night long compresses the nerves of the brachial plexus, causing that annoying tingling in your hands and arms. But the worst part is that it also reduces the blood supply to your brain. A Stanford study recorded up to 43 episodes of cerebral blood flow dips per night in those who sleep this way. It's as if your brain is experiencing micro blackouts all night long. Think of Teresa Aguilar, a 63-year-old retired nurse. Who would know more about health than her? Well, she started having memory problems and a brain fog she couldn't understand. She felt slow, confused. The cause wasn't age, but chronic postural hypoxia from the way she slept. This years-long habit was taking a heavy toll on her mental agility, and she had no idea. Her own arm pillow was betraying her. Luckily, the solution is simple and even comfortable. Invest in a good anatomical pillow, one that fills the space between your ear and your shoulder so your head can rest without crushing anything. And learn the quarter-turn technique, which is to lean back just a little to free up your shoulder. Works like a charm. You see, even the most common things have a trick to them. But if you think this is bad, you can't even imagine the mess that's created in your spine and arteries with the next position. Now, let's move on to the champion of twists, the one I call the pretzel position. I'm sure you know it. It's that one where you sleep on your side, but with one leg crossed way over the other, twisting your spine like you're a circus acrobat. You think you're releasing tension in your lower back, and it might provide momentary relief, but in reality, you're creating a major risk for the blood flow to your brain. By doing this twist, you're pinching the vertebral arteries, which are responsible for carrying no less than 20% of the blood to the back of your brain. It's like trying to drink from a bent straw. The blood flow becomes turbulent, and, again, the risk of clots forming skyrockets. You are literally strangling a vital pathway to your head while you sleep peacefully. The case of Thomas Andrade, 55 years old, is a brutal example of this. He suffered a stroke right in the posterior circulation of the brain, the area supplied by these arteries. It was no coincidence. Doctors couldn't find any clear risk factors until his wife mentioned his strange sleeping posture. Every night, without knowing it, his habit was paving the way for a neurological catastrophe. But don't panic. The solution is to become an architect of your own bed. It's very easy. Place a pillow between your knees to align your hips and another smaller one supporting your waist to keep your spine straight as an arrow. It's that simple. We've seen less obvious dangers and some very common ones, but I still haven't told you about the true queen. The one that tops the danger charts and multiplies the risk in a frightening way. And so we arrive at the crown. Jewel, the sleeping position that takes the prize for the most dangerous of all. The fetal position with your chin completely tucked into your chest. I know it sounds comfortable, almost like a refuge, like returning to the womb, right? But believe me when I tell you it is a true death trap for your brain. This habit, which seeks comfort, is the one that hides the greatest risk of all, without a doubt. Why is it so terrible? Because you create a double blockade. On one hand, you compress the carotid arteries, reducing the inflow of blood, and on the other, you crush the jugular veins, preventing its outflow. It's literally creating a circulatory traffic jam inside your skull. And if you think I'm exaggerating, listen to this. Harvard Medical School discovered that people who sleep like this have an 11 times greater risk of suffering a stroke. 11 times. The story of Ricardo Salazar, 68 years old, is the human face of these statistics. He arrived at the hospital with an acute stroke, but when the doctors saw his scans, they were stunned. His brain was full of old lesions, marks from small strokes he had been accumulating for years without knowing. His habit of curling up in a ball, seeking comfort, cost him the ultimate price. Every night, without realizing it, he was playing Russian roulette. But we're not just here to scare you, but to provide clear solutions. To avoid this silent catastrophe, the solution is surprisingly simple. Use a soft cervical collar at night. The soft kind, don't worry. And hug a body pillow. The collar will prevent you from flexing your neck too much, and the long pillow will force you to keep your body more stretched out. Now you have the complete map, from the seemingly harmless positions to the most lethal of all, and you know how to protect yourself. Now you know. The knowledge you've just received isn't a mere curiosity. It's a tool of power. You hold in your hands the map to a danger that lives in your own bed. A silent enemy. You now have the weapons to fight. You've learned that a gesture as simple as placing a pillow or straightening a leg can be the difference between a healthy brain and a silent catastrophe. But let me be very clear. Knowledge without action is absolutely useless. None of this matters if tonight, out of sheer habit, you go back to that position that is harming you. Inertia is the enemy of health. That's why I want you to ask yourself a question and answer me with complete honesty in the comments. Which of these 5 positions is yours? Acknowledging it is the first step to changing it. And now the most important question. Are you going to continue being a victim of your nightly habits? Or are you going to take control and turn your hours of sleep into a repair and protection workshop for your brain? Your future health is being decided right now in the choices you make today. Are you ready to make the right choice? If this video has opened your eyes and you want to continue learning how to protect your body in ways no one else tells you about, do 2 things right now. Subscribe to the channel and hit the notification bell. There's a whole universe of hidden health information I want to share with you. Take good care of yourself and above all, sleep well.